Hello, my name is Kat, and I am going to discuss the criminalization of nursing errors. Listed here are the objectives for what the learner should gain from this presentation, which include that at the end of this presentation, the learner should be able to correctly list 2 ways criminalization of nurses influences the nursing profession, 2 types of intentional harm inflicted by nurses, and 2 ways that criminalization of nurses negatively impacts patient safety. The heart of nursing relies on the trust from others that we want to help them, yet nurses are still people who make mistakes at the end of the day. Every day that a nurse goes to work, they are put in high-risk situations, running on little sleep with unrealistic assignments, but the mistakes they make can be deadly. Nurses are put in situations where mistakes are difficult to avoid, and this puts patients and the nurse's license in danger. Mistakes can be completely accidental, human error, but they can also be purposeful, criminal acts, which is where this topic walks a fine line. According to, and excuse my pronunciation, De Campos, Bragda, Mazianho, and De Freitas 2021, nurses who intentionally inflict harm to patients or do so through negligence or malpractice are treated as criminals in the court of law, and their acts can be deemed homicide. This presentation is going to discuss the criminalization of nursing errors and its impact on nurses, healthcare, and society. Nursing practice is largely impacted by the risk of potential legal action against nurses. Many nurses are leaving the field in fear of being criminalized for mistakes. With this risk, there are also issues surrounding the reporting of mistakes and the honesty of nurses. Mistakes put the nurse in danger as well and lead to dishonesty and sweeping things under the rug because the fear of consequences. According to Townley et al. 2022, a just culture promotes the recognition of human error and accountability for it without punishment. Just culture is built on trust and recognizes and corrects failures without punishment to the nurse, depending on the degree of intent and recklessness. Having a just culture would lead to more nurses coming forward with mistakes and thus improve patient safety, yet the criminalization of nurses does the opposite. The Swiss cheese phenomenon discusses how errors must pass through multiple system failures from multiple people before reaching the nurse and immediately after reaching the patient. So a just culture promotes accountability at other levels of the healthcare delivery system, and nurses are able to question safety concerns. Criminalization of nurses largely impacts healthcare because it exacerbates staffing shortages further, and less reporting leads to unfixed issues and more mistakes that greatly increase healthcare costs. As discussed prior, the high anxiety and stress that the nursing profession induces with the risk of facing legal action leads to more nurses leaving the field. This causes further stress on the nurses who are there, increasing mistakes and decreasing patient safety even further, forming a vicious cycle. There are also significant healthcare costs related to repeated mistakes and healthcare-associated injuries. With the data collected by Maher and Soek 2022, it shows that 17 to 29 billion healthcare dollars are based off of these mistakes. The fear instilled in nurses makes them less likely to report their mistakes, and those issues go unassessed, which leads to more mistakes being made and raising healthcare costs even further. As stated before, the fear of consequences leads to unsafe patient care with fewer reported incidents and short staffing. With less reporting, these mistakes go unassessed and may lead to further patient harm. Short staffing further increases stress and anxiety associated with mistakes and clouds a nurses' judgment, leading to inappropriate decision-making and more mistakes being made. According to Amin et al. 2022, criminalization of human error exacerbates the crisis that nurses face when working in a stressful, high-risk environment, and adversely affects research that improves patient safety. With so many issues hidden rather than reported, they are not addressed and will continue to happen. Amin et al. 2022 also mentions that restorative justice can help solve this problem because the institution would support the nurses in the face of a mistake with education and training rather than criminal action. This would improve patient safety since nurses would be more willing to be held accountable for mistakes, so the issues leading up to that mistake can be solved or the system can be improved upon as a whole. Nurses are not the only ones involved in a mistake, but they are the last person it reaches before the patient, so they often get pinned with the blame. But promotion of accountability from all areas involved would lead to safer patient care. To conclude, the criminalization of nurses is a difficult path to navigate. There is always the chance of intentional harm, and that must be investigated. But the question lies in whether or not nurses should be criminalized for unfortunate mistakes. The high-stress environment, along with unsafe ratios and distractions, leads to errors going undetected by all healthcare workers involved, yet the nurse is typically the one to be blamed. With the high stakes now faced in practice, there are large impacts on the nursing profession, healthcare, and society involving short staffing and further unsafe care. The use of a just system and a built community within the nursing profession would encourage the accountability of mistakes and facilitate change before dangerous events. With the risk of nursing being criminalized for human error that anyone could make, the profession is becoming unsafe for patients and nurses alike. These are my references.